Welcome to the Cook Children's Endocrine and Diabetes Clinic. Thank you for choosing our clinic for your child's health care. We know coming to a new clinic can be confusing to parents and sometimes even scary for children. So to make your visit more comfortable and helpful, we've put together some information for you. First, a little bit about what we do. Endocrinology is the study of hormones working in the body. Our medical team cares for children with hormone problems. Thyroid problems, growth, puberty, and diabetes are some of the conditions we see at our clinic. We have 30 employees who are part of our central Fort Worth staff. Some work behind the scenes. Our medical team is made up of board-certified pediatric endocrinologists, Medical Director Dr. Paul Thornton, Dr. Michael Wilcutts, Dr. John Dallas, Dr. Joel Steelman, and Dr. Jill Raddick. Pediatric nurse practitioners are Cindy Baer, Phyllis Wakeland, Mara Lindenfeld, and Teresa Newman. Other staff include certified diabetes educators, endocrine nurses, medical assistants, and nutritionists. A clinical therapist, social worker, child life specialist, and financial counselor are also available when needed. You can find more details about our team at our website www.cookchildrens.org. On the day of your first visit, we will need to review some important information. Please bring the following information with you. Ask your primary healthcare providers to explain the reason you need an endocrinology evaluation. Get medical records related to your child's visit. For example, if sent for growth, we need the growth chart and any blood work done by your primary care provider. Your child's health history is an important part of the information our healthcare providers use to make medical recommendations. Request records early because it may take a week or two to get this information transferred to us. Be sure to complete the family and medical history form as best you can. Bring all the medicines your child takes. This also includes non-prescription medicines. And know your medical insurance requirements. Every plan is different, but HMO plans generally require you to call your primary care provider for an authorization before your visit. Even if your child is following up from a hospitalization, an insurance authorization may be required for the clinic visit. Our Central Fort Worth Clinic is located on the south side of Cook Children's Medical Center, across the street from the main hospital in the Specialty Clinic building at 901 7th Avenue. The building is on the corner of 7th Avenue and West Terrell Avenue. You can park in the attached garage. Look for the color-coded fruit when you park as a reminder of your parking level. There's an elevator in the center of the building that you take to the 4th floor. Turn left when you get off the elevator and follow the signs to Endocrinology. When you first enter the clinic, sign in and show your insurance card. Be sure to bring your insurance card to each visit. Our desk registers patients for 11 doctors and pediatric nurse practitioners. We call patients back to the examining rooms according to the schedule for their provider. So some patients registering after you may be called back first if they see a different provider. Children with diabetes need their meter, blood sugar log, and a diabetes update form. Here are a few more things you need to know about appointments. Parents must be present for all children under 18 years of age. It is important for parents or guardians to be present for all clinic visits. However, we understand that unexpected situations happen. If you are unable to attend a clinic visit, another authorized adult must accompany your child. Please give this adult a signed note stating that you give permission for medical care. This adult must also know the important information related to your child's condition. Remember, we cannot see a child without this authorized adult present. If you are unable to keep your appointment, Please let us know as soon as possible so we can provide care to other patients who need appointments with us. Let us know ahead of time if you have a special need. If you're unable to bring an interpreter with you, we can schedule one for your visit. Before seeing a provider, we check the blood pressure, heart rate, height, and weight. Accurate heights are very important. Please style your child's hair so that braids or ponytails do not get in the way of an accurate measurement. Next, you go to the exam room to see either the doctor or a nurse practitioner. The nurse practitioner is a certified advanced practice nurse with a master's degree and special training in pediatric endocrinology. All of our nurse practitioners work closely with the endocrine doctors. They can diagnose and treat medical conditions, order and read lab tests, and write prescriptions. We alternate appointments with the endocrinologist and nurse practitioner. This means at one visit you will see the doctor, and at the next visit you will see the nurse practitioner. If your child has diabetes, it is important to tell us how you feel about your diabetes plan. We use the meter, log, and hemoglobin A1C test to help decide if the plan is working. In addition to the provider, you may see other members of our diabetes team. The diabetes educator, nutritionist, clinical therapist, social worker, financial counselor, and child life specialist are available to help when needed. We usually go to the education room to meet with these team members. Please allow enough time so that you and your child can get the most out of your visit. Some children need specialized testing called stimulation or stim testing to evaluate how well certain glands in the body are working. Growth hormone stimulation testing is the most common. If this testing is needed, we schedule a separate visit lasting 2 to 4 hours. You'll find out more details from your healthcare provider or nurse when it is ordered. Remember to get all of your prescriptions and the diabetes management plan from your provider before you leave. Stop by the window at the nurse's station for lab and X-ray orders. The lab order tells you what labs need to be drawn, when they need to be drawn, and if the labs are to be fasting. A bone age X-ray is the most common X-ray ordered in the endocrine clinic. When you are finished at the nurse's station, go to the checkout window for copay collection, appointments, and school and work excuses. One more thing you should know. We travel to outlying communities to provide care closer to where you live. Our satellite clinics are located in Hearst, Denton, Louisville, Waco, San Angelo, Midland, and Abilene. If you live closer to these areas, check to see if there are appointments available for you. We hope this information makes your visit with us as positive as possible. Please let us know if there's anything we can do to assist you with caring for your child. Knowing that every child's life is sacred, it is the promise of Cook Children's to improve the health of your most precious possession, your child.